Hi there, I'm Kaylee. I'm going to be your nurse today.
Hello.
Can you verify your name and your birth date for me, please?
Jessica Marabella, 6/12/2000.
Alright, good. That matches your chart. Alright, and there's the date. So, what brings you in here today?
I need an assessment of my body.
Okay, well, I'm going to do that. Before we get started, I checked your chart and you don't have any isolation issues, so you should be okay. Do you have any allergies I need to be aware of?
No.
Okay. Alright, so I would take your vitals and I would do all of that, and then I'm going to be doing a integument skin evaluation, and then I'm going to look at your head, your neck, your ears, your eyes, your mouth, and your throat, and your nose. So, and none of this is going to be invasive, and then I'm going to check some of your respiratory measurements. So, I'm going to start out by looking at your hair. I can see that it's evenly distributed. It's good hygiene. It's not thin or breaking at all. It's a good brown, straight color. So that all looks good. I don't see any infestations. Looking at her skin, I can see that it's a good color. It's nice and warm, and it's dry and moist. Everything's pretty evenly distributed. I can see some macules here and there, but everything looks good for the most part. Next, I'm going to look at your hands. I can see that her nails are a nice round, good shape. They're nice and thick. The capillary refills in less than 3 seconds, which is good. She doesn't have any clubbing in her fingers, which looks really nice. And overall, her nails look good. I would also do that on the toes, and I would be checking the capillary fill on all of the fingers. So that's the integument, and then next I would move on and do the HENT evaluation. So I would go back to looking at her hair. I would see that she hasn't had any trauma. There's no inflammation, no bruising or lesions or any drainage on her head at all. I would note that her face is extremely symmetrical. Her eyes look good. Her eyebrows are nice and full. Her eyelashes are full. Her nose is right in the midline, and all that stuff looks good. Can you smile for me? Frown for me. Put your eyebrows up for me. All right, good. So those cranial nerves are nice and intact. Do you feel this when I go on your face? That cranial nerve is also intact. Next, I'm going to look at your eyes. Do you mind closing your eyes for me? Once again, her eyebrows and her eyelashes are nice and full of hair. I don't see any lesions or bruising or inflammation at all, or no abnormalities. Will you open your eyes for me? I can see that her conjunctiva has got that nice good color, no drainage that's abnormal, and no lesions. Her iris and her sclera are nice, round, and uniform and symmetrical. And next, I would check her corneal reflex. Do you mind just staring straight at me? Those look nice and good. Also, I would check her pupils, and they're a good 3, and they need between 3 and 5, so that looks nice. Her pupils are also symmetrical, and they're nice and round. Will you stare at the pen for me? Her pupils accommodate and converge all right, and then also I'm going to check your cranial nerves and your muscles. Follow the pen. All right, those all look intact. Then I would do the Snellen chart, but we don't have that around, so that would be to test her visual acuity. Everything in her eyes look okay. Next, I would go on and I would look at her nose. I would notice that it's nice and symmetrical and round. I don't see any inflammation, bruisings, or lesions, or any open sores. Have you had any issues with your nose at all? Good. Then I would have you tilt your head up, and I'd look on the inside. I don't see any blockages or lesions or inflammation or anything, so that all looks good. And I don't see any arrhythmias, so that also looks very good. Next, I would have you breathe in one through one nose. Do it again for the other. Good. That looks good. So that cranial nerve is also intact. I'm going to look at your mouth now. I would see on the outside, close your mouth for me, that I don't see any lesions or bruises or open sores or anything like that. Her lips aren't cracked, and I don't see any coating of saliva or food, so that's good. When you open your mouth nice and wide for me. Her hard plate and her soft plate had nice good coloration, and I don't see any lesions or anything there. Her buccal mucosa looks intact. I don't see any abnormal colors or open sores or anything. Her tongue, her papillae are intact. They have nice good, lift your tongue up for me, vascularization, so that looks good. No open sores or inflammation or any bruises or lesions on that. So her mouth looks good overall. Next, I'm going to look at her ears. I noticed that there's nice and symmetrical. She has some piercings at the upper and lower, and I would palpate. Does this hurt you at all? Good. I don't see any lesions, inflammations, or bruising on your ears. Then I would look into each of the ears. The auditory canal looks nice and good. The cerumen levels are normal. There's no blockages. I don't see any sores or inflammation in there, so those check out. Next, I would come behind you. Excuse me. And will you tell me what sound you're hearing in your ear? Which ear? And the other one. Good. So then her cranial nerves are also intact for that. Next, I'm going to be looking at your neck, please. I would say that it's nice and symmetrical. I don't see any apparent swelling, bruises, or lesions. I would palpate along the trachea. That's nice in the midline. Does this hurt you at all?
No.
All right, so I don't see any inflammation once again or anything wrong with that. Would you mind putting your chin to your chest for me? Looking up, side to side. And then go against me. Good. Good. Lift your shoulders up. Good. So those cranial nerves are also intact. Next, I'm just going to palpate for your lymph nodes. Right here. Does this hurt you at all, or is it tender? All right, she didn't say it was tender, and I also didn't know any inflammation or swelling, so that all looked really good. So that completes my HEENT examination. Next, I'm going to do some respiratory evaluation, so I'm going to palpate her chest. Does this hurt you at all?
No.
Okay, good. And then I would come and do so on her back as well. I don't feel or hear any crackling or feel any bubbles or anything, so everything feels normal with that. Did that all feel okay to you? All right. And then, okay, also, like, when I looked at the integumentary, I didn't see, after inspecting, I didn't see any abnormalities on her chest or on her back. Her breathing pattern seemed normal. And then I would note all of her anatomical landmarks. And then now I'm going to just check her breath sounds. So do you mind if I put my thing underneath your shirt? All right. So take a deep breath for me. And again. Sound good. And then I would do so on your back. Alright, everything sounds good. I would do 8 points on the front and 10 points on the back. That's everything for her respirations. And I report and document all of my findings. Next, I would do patient safety. I'd put both of the bed rails up, give them the call light, let know the red button gets hold of me, and the rest controls the TV. If she was a fall risk, I'd turn the bed alarm on, put the bedside table there, clear any clutter. Is there anything else I can get for you today?
I'm good.
All right, thank you, Jess.